Let's define our terms. People use morality and ethics interchangeably, but in this course, we distinguish them. Morality refers to the shared norms and values of a community, the gut feeling that stealing is wrong or that we should help the poor. It is the what. Ethics is the systematic analysis of those norms. It is the why. Ethics is the science of morality. It asks, why do we help the poor? Is it because God said so? Or because it increases utility? Law, on the other hand, is the enforceable minimum. Law is what the state can put you in jail for violating. Ideally, law reflects morality, but they often diverge. Slavery was legal, but it was unethical. Speeding to the hospital to save a life is illegal, but it might be ethical. We must learn to navigate the gaps between what is legal and what is right.
You have all heard of the social determinants of health, housing, food, transportation. Dr. Don Berwick, former head of Medicare, pushed this further. He talks about the moral determinants of health. He argues that the existence of poverty, homelessness, and hunger in a wealthy nation is not an economic accident. It is a moral choice. Every time a legislature passes a budget, they are making a moral assertion. If we fund dialysis, but not prenatal care, we are saying that extending the life of an elderly person is more valuable than ensuring the healthy birth of a child. We don't like to say it that bluntly, but that is what the budget says. In this course, we will learn to read policy documents as moral anthropology.
We divide bioethics into 3 levels. The first is microethics. This is the clinical encounter. It is the doctor and the patient in the exam room. The focus here is entirely on the individual. The doctor has a fiduciary duty to that specific patient. If I am your doctor, I am not thinking about the national debt or the supply of organs. I am thinking about you. The core values here are trust, confidentiality, and informed consent. For thousands of years, the Hippocratic tradition focused almost exclusively on this dyad. It assumes resources are unlimited, and the only question is, what is best for this person? Zoom out to mesoethics. This is the institutional level. This is the world of the hospital administrator, the insurance executive, or the clinic manager. Here, you cannot just look at one patient. You have to look at the whole building. You have to balance the budget. If you hire 10 more nurses for the ICU, you might have to close the outpatient psych clinic. Mesoethics is where the idealism of medicine meets the reality of business. The conflicts here are often between financial viability and patient care. Is it ethical to discharge a patient early because the insurance ran out, even if they are medically stable? That is a meso-level dilemma. Zoom out further to macroethics. This is the level of public health policy. This is where the government operates. Here the patient is not an individual. The patient is the population. The values shift dramatically. We care less about individual autonomy and more about justice, efficiency, and security. At the macro level, we might mandate vaccines, tax soda, or ration organs. These actions might harm or restrict specific individuals to save the group. This course focuses heavily on the tension between the micro, I have rights, and the macro, we have needs. Most political anger comes from the friction between these levels.
Let's look at an example of this tension: antibiotic resistance. From a microethics perspective, if you have an infection, your doctor should give you the strongest antibiotic available to cure you quickly. That is their duty to you. But from a macroethics perspective, if everyone uses the strongest antibiotic, bacteria will evolve resistance and the drugs will stop working for everyone. So, the public health department restricts the use of those drugs. They sacrifice your immediate convenience for the future safety of the herd. This is the tragedy of the commons. What is rational for the individual is disastrous for the group. Bioethics is often the referee in this conflict. Where did this field come from? Before the 1970s, medical ethics was mostly doctor etiquette. It was paternalistic. The doctor knew best. Then, two things happened: technology and scandal. We invented machines that could keep dead people alive, ventilators, and machines that could clean blood, dialysis. Suddenly, we had to decide when to pull the plug and who got the kidney machine. Simultaneously, scandals like Tuskegee revealed that doctors couldn't be trusted to police themselves. This explosion created the need for a new profession, the bioethicist. Philosophers, theologians, and lawyers were brought into the hospital to help navigate these new, terrifying powers. Your role as a policy analyst is to be a translator. You sit between the values of the community and the technical data of the scientists. You need to identify the hidden curriculum of a policy proposal. When a politician proposes a tax cut for hospitals, who actually benefits? Is it the rural clinic or the massive urban research center? You must ask who pays and who decides. You need technical competence. You have to understand the math, but you also need moral imagination. You need to be able to imagine what this policy feels like to the person with the least power in the system. A quick word on expectations. This course deals with life, death, sex, and money. We will discuss abortion, euthanasia, rationing, and racism. These are heated topics. I do not expect us to agree. In fact, if we agree on everything, we aren't thinking hard enough. The goal is not consensus, the goal is clarity. I want you to be able to articulate your opponent's argument better than they can. We will treat every worldview with respect, but we will subject every argument to rigorous critique. Leave your fragility at the door. We are here to do serious work. To conclude, Lesson 1, we have established that health policy is not just about logistics, it is moral anthropology. We have distinguished between the micro world of the bedside and the macro world of the state. We have realized that good ethics sometimes requires bad politics, and vice versa. In the next lesson, we will look at the specific tools philosophers have built to solve these problems. We will examine principlism, the 4 principles that dominate American bioethics, and ask if they are enough to handle the complexity of a pandemic. Thank you.